Good afternoon. Thank you for joining us for today's webinar on the FTCA. What do I need to do in order to submit the application? Before we start, unfortunately, Jeff Adest is not feeling well and is unable to join us. He apologizes for not being here, but he lost his voice and he's unable to speak. So we send him our best wishes for a speedy recovery. If you have any questions, please enter them in the questions box and they'll be answered after the webinar if we don't have time. And we'll begin. So let's start with a quick overview of the Federal Tort Claims Act. So in the event an FQHC is subject to malpractice or a health-related claim, the FTCA may provide coverage for such claims. So the employees of eligible FQHCs may be deemed federal employees, and the FQHC grantees are immune from medical malpractice lawsuits resulting from performance of in-scope services. And the FTCA would compensate your patients who have suffered personal injury due to wrongful acts of employees of the U.S. government, and employees of the eligible FQHCs would be considered federal employees for this purpose. And the way to get FTCA coverage is through an annual application. So eligible FQHCs must submit an initial deeming and then annual redeeming application to HRSA. It seems like we just finished submitting our FTCA application, and here it is upon us again. So the electronic handbook system, or the EHB, opens to accept applications on May 4th. The applications must be submitted by June 4th. That's a hard deadline, so you have to get them in by June 4th. Now, a little bit of history. Last year, HRSA released an FQHC program compliance manual, and they released this after the 2017 applications were submitted. And so what the compliance manual did was it clarified or changed many of the requirements that were included in last year's application. So this year we have to be mindful of any changes made by the compliance manual that has to be included in this year's FTCA application. Also new this year is the opportunity for FQHCs to apply for coverage for their volunteers under HRSA's Volunteer Health Professional, or VHP, FTCA program. And we'll talk about that a little bit at the end. So this year's application includes many yes or no questions. Last year, if you recall, FQHCs had to describe in detail what their policies and procedures were. It didn't require you to upload many documents. It was really describing within the application what your policies and procedures were on risk management, QA, QI, claims processing, confidentiality. This year, there's a lot of yes or no questions, and it would ask you to attest to having policies and procedure in place that meet HRSA requirements. So this looks easier for the FTCA application purposes, but you have to remember that you have to have the underlying policies and procedures in place in order to correctly attest that you do have these in place, and they have to be you have to make sure that they meet the compliance manual requirements. And remember too that OSV reviewers will be looking at these policies and procedures when they come out, and they will be looking to make sure that they comply with the FTCA and HRSA compliance manual requirements. And also, HRSA took this opportunity to clarify that all supporting documents must be from the current calendar year or the previous year. So like last year, the 2019 FTCA application is broken down into 4 sections: risk management, quality improvement, credentialing, and claims management. And we'll talk about risk management first. So Again, last year you had to describe in detail within the body of the application your risk management program. This year, the application requires you to attest that you have implemented an ongoing risk management program. And you're attesting that you understand that the failure to implement a program, an ongoing program, and provide documentation of implementation may result in disapproval. And again, you'll need to be able to show that you have the right required documents during the OSV. So like last year, you must designate an individual responsible to oversee the risk management program. Now, the risk manager has to complete annual healthcare risk management training. So be sure that by June 4th, the risk manager had completed the risk management training program. Health centers also have to upload the position description for the risk manager, and HRSA stressed with this to make sure that the description includes risk management activities. Key components of your ongoing program should include claims management, complaint resolution, confidentiality. Again, these are key areas to focus on when we're talking about potential risks. So confidentiality of patient records, release of information, compliance efforts, event investigation, root cause analysis and follow-up, credentialing and privileging are big. So all of these should be touched on in your risk management plan. This year, you have to attest that you have risk management policies to reduce the risk of adverse outcomes that could result in medical malpractice. And you have to make sure that your policies include activities like triage, including telephone triage. So someone comes in and they're complaining of certain symptoms, or they're calling on the phone and they're complaining of, maybe heart palpitations or something that requires more immediate attention. The policy should include scheduling. Do you make available sick visits or visits for walk-ins? Missed appointments. Do you do anything if someone routinely skips appointments? Intake, tracking, and follow-up is huge, as it was last year. It also has to incorporate risk management training for all staff, completion of quarterly risk management assessments, and annual reporting to the board. So this year, like last year, you'll have to upload your referral tracking policy, the hospitalization tracking policy, and diagnostic tracking policies, which includes x-rays and labs. For the hospital tracking, they want to see a closed loop system. So from when you send someone to the hospital to discharge, whether you're getting the information, things that should be included in your tracking system include patient information, date of admission, date of notice, reason for the visit, and documentation requirements. When did you request it and when did you receive it? So, we talked about how the compliance manual changed some of last year's requirements. So last year, the application required that hospital tracking policies include notification of hospital admissions and ED visits for both those patients that FQHCs sent to the ED and for those who entered on their own. In the compliance manual, HRSA understood that it was difficult to get information from the hospitals when the patient entered on their own. So they changed this by requiring that FQHC's risk management procedures track hospital admissions only of those patients sent to the ED by the FQHC, and eliminated the requirement that the FQHC obtain notification from hospitals on patient admissions. So, this is provides a little bit more flexibility. You should definitely revise or incorporate the new compliance manual requirements into your risk management procedures, and especially this hospital tracking policy. Now, please note you are still required to receive hospital discharge follow-up instructions and lab results, and you have to include this language in your operating procedures and your formal written referral arrangements with hospitals. So look at your operating procedures and also look at your agreements, your referral agreements, to make sure that it touches on obtaining this information. So referral tracking policy requirements are similar to last year's requirements. They must include defining the referral type, how it was initiated, the tracking elements that are noted below in the slide. So frequency of follow-up, are you going to follow up 2 times? Who does the follow-up? How are you documenting follow-up? Is there patient compliance issues? Is there no, did the patient not complete the referral because they skipped the visit? So the referral tracking policy must include documentation in the patient's medical record of the follow-up efforts, missed referral appointments, and frequency of attempts and attempt methods. The third policy you have to upload is the diagnostic lab test tracking policy. And this year, HRSA clarified that your policy must talk about both diagnostics and lab testing. It wouldn't be sufficient if it just, mentioned diagnostic, and maybe that was meant to cover labs as well. Make sure that it clearly mentions both, and also make sure it's all in one policy. Sometimes it could cause confusion if you have a diagnostic test tracking policy and then a separate lab test tracking policy. Make sure it's in one policy. So tracking elements for this include patient information, date the test was ordered, the ordering provider. It includes, follow-up recommended by the provider and communication of results to the patient. So the tracking policy has to define normal, abnormal, and critical values for each lab and a time frame to communicate the results back to the patient. And HRSA requires that all results, including the normal results, be communicated back. So the policy should consider such things as how will the normal results be communicated? How do you contact a backup provider if you receive an abnormal result or a critical value and the provider that ordered it is out on vacation? How do you establish a backup provider to make sure that the results are communicated back to the patient within the time frames you established? You have to include tracking and monitoring of critical values and incorporating audits of how the policy is implemented into QI/QA. So again, last year you had to describe your risk management operating procedures, and this year you simply have to attest that you have them in place. And again, make sure that your policies and procedures include the things required, including identifying the areas and activities of highest risk, mitigating those high-risk areas, including through establishing or using clinical protocols, training, and medical staff supervision. Those are the specific examples given by HRSA, so you want to make sure that you include it in your policies and procedures and incorporate it into your practice. So operating procedures also include documenting, analyzing, and addressing complaints and near misses. What HRSA wants to see is that you have a system in place where you are informed of complaints or near misses where something could have happened but it didn't happen, and then figuring out what happened and trying to address it to make sure it doesn't happen again. You have to set and track progress related to annual risk management goals. So that means you have to establish risk management goals on an annual basis and then track what activities you're doing and how you're doing. So are you meeting your goals? Do you have to change them in any way? You have to develop and implement an annual healthcare risk management training plan, and we'll come to that a little bit later because it plays a bigger role this year. And you have to complete an annual risk management report for the board and key management staff. So as I was saying, training is an important component of the risk management plan. So this year, you attest that you have developed and implemented healthcare risk management training plans for staff members. Specifically, you have to make sure that your plans incorporate obstetrical procedures. This again is similar as last year, but you have to make sure it's in your training plan. Infection control and HIPAA medical record confidentiality requirements. And the training plan is important because this year you have to upload it as part of your application. So you'll be required to upload the training plan and also upload any and all tracking documentation of how you track that training has been completed. And so quickly, the training plan, the risk management training plan is different than the risk management plan. The risk management plan describes your overall ongoing program for risk management. And the training plan lists out what you've identified as risks in the training that you've identified to help with those risks. And the training would be training for all staff and then specialized areas for specialized staff, like the obstetrical training for the OB clinical staff. And then you have to track that training has been completed. And so when you complete the FTCA application, you have to show how you track that training is completed. It could be a spreadsheet with the name of the program, the training program. You know, you'll have one list saying employee and date program offered, you know, verifying that they did it, maybe a sign-in, sign-out sheet. Some way you have to identify how you track and document that the trainings that were in the risk management training plan have been completed. So again, I think I touched on this before. The training plan should outline the required courses for all staff and training for specialty professionals. You have to track attendance and completion. Completion of training must be part of performance reviews and credentialing and privileging. You have to have a process for handling those staff who fail to complete the required training. And again, just to remind you that the risk manager has to complete the healthcare risk management training in the last 12 months. So make sure that the risk manager has completed the training by June 4th. Now, the governing board has certain requirements. They have overall responsibility for risk management. They authorize approval of the risk management plan. They receive and review the annual risk management report, which includes those elements. Now, the 2019 FTCA application requires that you upload the most recent report to the board, which incorporates all these elements, including that evidence that related follow-up actions that they may have recommended have been implemented. So please review your risk management report, make sure it hits on all of those elements, and if there was any recommended follow-up, you'd want to have documentation that the follow-up has been implemented. So quickly, when we're talking about risk management, we're looking at those areas that have the potential to lead to a health-related claim. And the big areas of focus include if there's diagnostic errors, communication problems, failure to follow up, staffing patterns and workflow, maybe there was insufficient staff to handle issues, technical failures, and inadequate policies and procedures. It's really important to make sure your policies and procedures are up to date with all the current requirements. And ways to mitigate risk is performing a careful assessment, respond promptly to alarm symptoms, obtain a well-executed informed consent. If there's procedures that are being recommended or being done, make sure the informed consent adequately describes the risk or at least states that the patient was advised of the risks. Use the event as a shared learning opportunity. HRSA really likes to see an open communication or open dialogue among staff so that things can be reported and investigated. And with that, performing an accurate investigation and report of the events. So again, about the policies, it's really important. I mean, HRSA will look at them when they do the OSV, so it's really important to have well-established policies that are effectively implemented in compliance with current law and the compliance manual, to have active quality assurance risk management activities, peer review, having an informed governing board, and robust privileging and credentialing program. All right, let's move on to quality improvement and quality assurance. That's the second area that the FTCA application focuses on. So last year, you had to describe your QI program. A lot of the questions last year were really detailed, and you had to provide a lot of detail in writing. There's a lot of uploads this year with the QI program. So this year, you have to upload your QA plan and supporting documents. I think in prior years it was your QI plan or such things as minutes or reports, but this year the application requires you to upload both. And they gave as examples of supporting documentation QA minutes and a QA report. Now last year I think they recommended or asked that you submit 6 months worth of minutes. This year, they do not have the 6-month requirement, but they said it's up to the health center to upload enough minutes to prove that they have an ongoing program. So your policies and supporting documentation must show that your operating procedures address adherence to current evidence-based guidelines, standards of care, and standards of practice, and a process to identify, analyze, and address patient safety, adverse events, and implementing follow-up actions. So these are really the words that they're looking for and procedures that address these things. So you want to make sure that it's in your policies and procedures. Your procedures must also address a process for assessing patient satisfaction. I mean, do you do it by survey, or do you have a system where maybe your call center calls patients? You have to have a process for hearing and resolving patient grievances. You have to complete periodic QA assessments on at least a quarterly basis. And please note with this, last year, before the compliance manual came out, the requirement was that you complete periodic assessments. It didn't say on at least a quarterly basis. So you have to make sure that your QI plan acknowledges that you do this on at least a quarterly basis. The compliance manual made that change. And again, this was done after last year's FTCA application. And your process also has to include the ability to modify FQHC services based on findings of the QI assessments. So this year's application requires you to upload documentation that you performed these assessments. And documentation can include reports, committee meetings, or documents called QI assessments themselves. And make sure that they have all of the elements of QI assessments in there. They have to be completed on a quarterly basis again. The QI assessments over the past calendar year, so they're looking for a specific window of time, include assessing adherence to the current evidence-based clinical guidance, identification of patient safety and adverse events. They must be done by physicians or other licensed healthcare professionals under supervision of physicians. They have to use patient records, data gathered from patient records, and they have to include chart audits and peer reviews. So the compliance manual clarified that the FQHC determines whether the person in charge of QI is an employee or contractor, full or part-time, or whether this person is combined with another position. the person who's in charge does not have to be a clinical person, but the QI, QA assessments must be done by clinical staff. So let me go back to the previous slide. So the QI, QA program director, this position can be combined with another position at the FQHC. However, they made clear in the FTCA application that first you have to upload this person's position description, and the job duties in that position description must include QI, QA activities, and specifically ensuring implementation of and updating QA, QI operating procedures, completion of assessments, and monitoring outcomes. So make sure whoever holds the position of QI director, make sure these specific job duties are included in their job description. Also, they're requiring that the job description clearly detail that QI, QA activities are a part of the individual's daily responsibilities. Now, last year you had to specify that you had an EHR system, and you also had to describe your policies and procedures in place for protecting the confidentiality of patient information. And this year you're simply attesting to it with a yes or no answer. Governing board requirements for QI/QA. The board receives the report, and board meeting minutes must document that the report was shared with and discussed by the board to support decision-making and oversight, and any follow-up actions have been taken. And you must upload the report and meeting minutes with this year's application. And a reminder that the compliance manual requires that the QI/QA policy be reviewed by the board at least every 3 years. Okay, the third area we're moving to is credentialing and privileging. So the 2019 FTCA application requires an FQHC to attest that it has implemented a credentialing and privileging process and operating procedures. This year, you have to upload your credentialing and privileging procedures that address all of the elements listed in the FTCA application and the compliance manual. And the compliance manual actually made significant changes to credentialing and privileging. Prior to that, we relied on various PINs that HRSA issued on credentialing and privileging, and the compliance manual superseded the PINs, and now all the requirements are in the compliance manual. One of the things that the compliance manual did was define the personnel that credentialing and privileging applies to. So like before, it applies to licensed independent practitioners, so your physicians, dentists, PAs, and NPs. Other licensed or certified practitioners, so that would include your RN, LPN, and registered dietitian. And there's a third category of personnel, which HRSA defined as other clinical staff providing services on behalf of the FQHC. Now, for states that don't have certified medical assistants would fit within this third category. But you have to look at your credentialing and privileging policy because you have to make sure that it also addresses this third category now, the other clinical staff. So credentialing elements include verification of current licensure, registration or certification, and this still requires primary source verification. You must verify education and training of initial credentialing. Primary source is still required for licensed independent practitioners, and you have the option for primary or secondary source for others. You still have to do a data bank query, verify DEA registration, and basic life support. Privileging elements include verification of fitness for duty. The prior requirements had you assess mental and physical fitness. Here they leave it as fitness for duty, and they define it as the ability to perform the duties of the job in a safe, secure, productive, and effective manner. And they're really giving health centers flexibility to determine what that is. You must also verify immunization and communicable disease status. For initial privileging, you verify current clinical competence through training, education, and, if available, references. For renewal, you have a little bit more flexibility. You verify current clinical competence through peer review, but they also allow other methods, including supervisory performance reviews. And you also have to have a process in place for denying, modifying, or removing privileges based on assessments of clinical competence. So really, you want to make sure that your credentialing policies and procedures allow you to take advantage of some of the flexibility given to you by the compliance manual, including for renewal of privileges and how you verify current clinical competence. The application requires you to attest that your files or records for clinical staff have document licensure. Again, this is a yes or no. You have to attest that in your contracts with provider organizations or formal written referral arrangements, that your contracts or formal written referral arrangements have terms that ensure that the providers are licensed through, or are the providers that are used to provide in-scope services go through a credentialing process and a privileging process that meet applicable law. So you want to take a look at your contracts to make sure that they have those provisions in there. And again, the compliance manual made some important clarifications regarding credentialing and privileging. FQHCs are not required to employ their clinical staff. You can have contracts with providers or provider organizations, except that early this month, HRSA issued a primary care digest that noted recent revisions to the law, and the law now requires a health center to directly employ its CEO. And they're going to release an updated compliance manual and site visit protocol. They indicate they'll do this by July 2018. That's just something to keep in mind. And again, other compliance manual clarifications that you want to incorporate into your credentialing and privileging policies. You have the flexibility to determine who has approval authority for credentialing and privileging. Verification of current clinical competence, again, I had mentioned it before, can be done through peer review or through supervisory performance reviews. And you can determine how credentialing will be implemented. If you contract with a CVO or you do it on your own through your own staff. Moving on to the last area in the application, claims management. So this year, an FQHC must attest that it has a claims management process for addressing claims, including medical malpractice. Last year, you had to describe this all as well. The process has to include preserving documents related to any actual or potential claim, including medical records, lab and x-ray results, billing records, clinical operating procedures, and employment records. And the process has to include prompt notification to the Office of General Counsel of HHS if you receive service of process or a summons related to an alleged claim or complaint. So last year, you had to indicate whether you had any claims during the past 5 years, and you had to upload a document or a spreadsheet that listed out the claims and gave certain dates and information and activities that you did as a result of the claim to minimize it from happening in the future. But this year, instead of uploading the spreadsheet, you're actually going to input all of this information right into the system. So it's not an upload of a spreadsheet, it's just inputting it, and which includes a summary of your internal analysis and activities taken. Here too, you have to upload the position description of the claims manager, and they stress that it must include claims management activities. This is similar to last year's requirement. You must attest that you inform patients using plain language that the FQHC is a deemed federal public health service employee. You could do it through your website, promotional materials, or you could post it on an area of the wall or within the FQHC that is visible to patients. What's new this year is that if you post it on your website, you have to upload or insert a link to the exact location where the information is posted, or you upload promotional materials. If the way that you make it known to patients is by hanging signs on the wall, you have to take a picture of the sign and upload a picture onto the application system. They also provide sample language of what the notice could be. The sample they provide is, this health center receives HHS funding and has federal public health service deemed status with respect to certain health or health-related claims, including medical malpractice claims for itself and its covered individuals. This is in the application, so you'll be able to see it. Take a look at how the language you use and compare it to what they have to make sure that it's similar. And the compliance manual clarified that FQHCs have flexibility in determining how to inform patients of their deemed status. So you can choose to inform them by website or promotional materials or a sign. But however way you do it, you have to upload proof that you're doing it. Okay, and we're going to take the last few minutes just to talk about the volunteer health professional coverage under the FTCA. A little bit of background. As part of the 21st Century Cures Act, which was effective last year, a volunteer, or VHP, may be deemed a public health service employee for FTCA coverage if certain conditions are met. They do not receive deemed status automatically. So just because a health center is deemed a federal employee doesn't mean the volunteers that are providing services through the health center are deemed as well. It's a separate application process altogether. And the FQHC must sponsor a volunteer and then submit an annual deeming application on behalf of the VHP. So the person has to be specifically named on the application, and they specifically will be deemed an employee. And it's a yearly process similar to the FTCA for health centers. So during this 2019 FTCA deeming cycle, an FQHC can submit a separate deeming application for VHPs, and HRSA indicated that there's a separate application tab in the system for these applications. They're also due on June 4th, and outside of this cycle, separate rolling applications are allowed. So what HRSA said was the system will be available outside of this FTCA application period. However, right now, they're just focusing on the FTCA and that process. So when you're able to submit an application now for VHPs using the separate tab, but then once the system closes on June 4th, you'll have to wait until they reopen it to submit a VHP application after June 4th. So the FQHC and the VHP must meet certain requirements in order to qualify. The FQHC itself must be deemed for the applicable period. The VHP requirements, the service must be in scope. The FQHC must sponsor the VHP by name. So the application has to include the volunteer's name. The volunteer cannot receive any compensation at all for the service from the patient, from the FQHC, or any third-party payer, including Medicaid. And this applies only to the VHP and not the FQHC. So the FQHC can still bill for the service rendered, but none of that money can go to the volunteer. However, HRSA did clarify that the volunteer can be reimbursed for reasonable expenses. And just one note on that, some examples of reasonable expenses would be mileage going to and from the site if they're going to a particular site. If for some reason they require lodging in order to provide the service, that would be a reasonable expense. So before the service is provided, the volunteer or the FQHC must post a notice at the site where the service is provided, stating that the volunteer is a deemed employee and that they have limited liability for their service provision. And when the service is provided, the volunteer must be licensed or certified. And they also have to go through your normal credentialing and privileging process. And HRSA made clear that residents, students, and interns are not eligible for the VHP program for two reasons. They said that residents, students, and interns are not true volunteers. Like a resident is there as part of a residency program. Same with students and interns. They're there for a specific reason and aren't volunteering in the traditional sense. And they also said they wouldn't qualify for the program because they have to, a VHP must be licensed or certified in accordance with law. So there's documentation requirements that the FQHC must maintain, including all the credentialing and privileging information. The VHP and the FQHC must have entered into a written signed volunteer agreement. They must acknowledge that the volunteer will not receive any compensation at all. And it has to list the off-site activities that the volunteer will provide for the FQHC. Okay, now we've come to the end of our program. We'll see if we have any questions. Okay, the first question is, do we need to upload the QI plan and minutes, or just one to show we have a QI program? Yes, this was a question that was also brought up during the HRSA webinar. The application asks for both the QI plan and the supporting documentation. And again, this could include QI minutes or QI reports. Our second question, if we submit a volunteer FTCA application with the name of a few volunteers, can we also submit another one later with the name of additional volunteers? And the answer is yes. After the FTCA application period, the deeming application period is over, so June 4th, HRSA stated that they'll reopen the EHB, and at that point, they'll accept rolling applications. Okay, this concludes our webinar on the FTCA application requirements. A copy of the presentation will be sent out. And if you have any questions, please feel free to call Jeff Adest or myself, and we'd be happy to answer any questions for you. Thank you.